This is a video on pelvic organ prolapse, supports of the uterus, and POPQ classification. Supports of the uterus is divided into three tiers: upper tier, middle tier, and lower tier. Upper tier support of the uterus is provided by round ligament, which is attached on either corneal side of the uterus, traverses through the inguinal canal and is attached to the labia majora. On either side, there is presence of a broad ligament which has loose areolar tissue inside it, attached on both the sides, and condensation of the endopelvic fascia which coats the uterus. Middle tier of the uterus is the main support of the uterus. It is provided by the dense condensation of the endopelvic fascia all round the level of isthmus and cervix. At the back, there is presence of uterosacral ligament that goes from the back of the cervix to the sacrum. On either side is the cardinal ligament, also known as McEnroth's ligament, transverse cervical ligament, attached on the lateral side of the cervix, and in the front is the pubocervical ligament. At the back of the cervix and vagina is the rectovaginal septum. Lower tier of the support system of the uterus is formed by pelvic floor muscles. Pelvic floor muscle, the main support is by levator ani. The parts of levator ani muscles are named according to its origin: pubococcygeus, iliococcygeus, and ichthyococcygeus. In addition to the levator ani, levator plate plus perineal body plus urogenital diaphragm forms the entire support system. Support of the anterior vagina and the posterior vagina is not by any bony tissue, but it is a condensation of the endopelvic fascia around them. It contains blood, lymphatics, collagen, and the facial tissue, which is condensed and provides support to them. So in the front is the pubic symphysis, and at the back is the sacrum. The muscles that traverse from the front to back also goes around the urethra, vagina, and rectum, and it goes around them, gives immense support to the bladder neck, to the vagina, and to the rectum. Now, levator ani muscles can be imagined as an hammock with three openings: one for the urethra, vagina, and rectum. So the part of the muscle fibers that goes around them, when it contracts, it keeps them closed and prevents any hernia. That's the diagram of the rectum, uterus and cervix with vagina in the front, and at the back is the sacrum and coccyx. There's something known as an anococcygeal raphe. It's a fibromuscular septum that supports and curls around the rectum and is also attached to the perineal body, which is the main support system of the posterior vagina. So perineal body receives the insertion of 9 muscles that maintains and provides support to the posterior part of the vagina. It is also responsible for the vaginal axis, and if the perineal body is disturbed, damaged, or injured, then this vaginal axis is distorted. So, if you were to revise the support system of the uterus, the upper tier is by the round ligament, the middle tier, which is the main support, is by the uterosacral ligament, and transverse cervical ligament, and the pubo-vesical ligament, which is in the front. So after going through the support system, it will be very easy to understand which part of the support system has become weak, which is indirectly responsible for the prolapse. So the type of the prolapse could be vaginal, which is divided further into anterior and posterior vaginal prolapse. Anterior is divided into the upper 2/3 and lower 1/3, which is Cystocele and Urethroceele, and posterior is divided into Rectocele, Enterocele, and the lowermost part, which is the gaping introitus or a relaxed perineum. So degree of prolapse, historically it was classified in 3 degrees: first degree prolapse, second degree, and third degree prolapse. First degree prolapse means the external os, which normally lies at the level of ischial spine, it descends down, but it still remains inside the vagina. Second degree means external os comes outside the vagina, but uterus remains inside the vagina. And third degree is when the uterine body comes outside through the vagina. And last we have precedentia, which is prolapse of the entire organ that comes out completely along with eversion of the vaginal walls. So POPQ classification, it's a standardized objective classification which is as follows. So external os, anatomical position is at the level of ischial spine. So this is a diagram that shows 2 horizontal lines, one at the ischial spine and other at the hymen. From the left to right, you can see the external os that lies at the ischial spine has started descending, and in the 4th and the 5th diagram, you can see it's going beyond the hymen. So the prolapse, we make it easier by drawing 2 lines, which is -1 centimeter and +1 centimeter from the hymen. And the stages of prolapse is divided into stage 0, which is no prolapse, that's normal, stage 1, stage 2, stage 3, and stage 4. So as we said, stage 0 is no prolapse. Stage 1 is when the leading edge of the prolapse is more than 1 centimeter above the hymen. Stage 2 is when the leading edge of the prolapse lies between -1 to +1 centimeter. Reference point is hymen. Stage 3 is the leading edge more than 1 centimeter. Reference point again is the hymen. And stage 4 is complete eversion. So if we draw the sagittal view of the pelvis, outlining the vagina, cervix, and uterus in the front, and rectum and anus in the back. So the anterior vagina will have 2 points, A and B. So the posterior vaginal wall will have 2 points, A and B. Cervix will have, the anterior cervix will have point C, and the posterior fornix will have point D. The vaginal introitus, genital hiatus, and the part of the perineum in between the vagina and the anus is the perineal body. From the hymen to the posterior vaginal fornix is the total vaginal length. So the anterior points are marked as A and the posterior points are marked as B. So the grid system is divided into anterior, middle, and posterior compartment. The top row is the anterior part, where the anterior vaginal will have 2 points AA and BA. So AA will be -3 to +3, BA will be -3 to total vaginal length, and C is cervix, which could be anywhere in between -8, which is inside the vagina, to +8, complete eversion. Genital hiatus, perineal body marked as 2 and 3 centimeters, and total vaginal length as 10 centimeters. Similarly, on the posterior side, AP is -3 to +3 centimeters, BP is -3 to total vaginal length or +8 centimeters, and the posterior fornix. So posterior fornix will not be present in patients who have had hysterectomy. So the top row is the anterior compartment and the bottom is the posterior compartment. Thank you for watching.